Well, good day to everyone, or good evening, depending on where you find yourself in the continental United States or anywhere else for that matter. I am Dr. Ortiz, Ariel Ortiz, and this is a show called Stay Home, Stay Healthy. And those are two difficult things to do, both of them. Anyway, so I'm streaming from this beautiful studio in my garage in Coronado, California, sunny California, where it's raining cats and dogs. So, in fact, I stepped on a poodle out there. Just kidding. Uh, it is Good Friday. Today's a Good Friday, so a lot of people are celebrating depending on your faith and what you believe in. Is Today is Good Friday for all Christians out there. Shout out to my friends and family and loved ones in Christ. And anyways, this is a questions and answers session, which are pretty interesting because as the days go by after doing one of these webinars, there's a ton of questions being asked online, and we like to select some of the ones that are most representative of the whole number of questions that we get after a webinar. These webinars are designed to feature someone important and essential, somebody with knowledge, wisdom, that can teach us something on how to cope with a COVID-19 pandemic and staying home, but staying healthy. So far, we've had this week Dr. Robert Sywes. Dr. Robert Sywes is a bariatric pediatric surgeon, general surgeon, over 20 years, a good friend of mine. But this guy is not only talented with his hands, he's talented with his brain. And what he's done so far is actually talk about the elephant in the room. He was talking about emotions and food. And come on, guys, everybody knows, all of us know that we have issues with food. It's very rare that you find somebody that says, no, I don't want to eat. Anyways, at least I do. And I find that emotions are associated to foods as long as we can think. Most emotions are really good, but sometimes when those emotions pass into something very aggressive, a lot more as a, let's call it what it is, it can drive to addictions. And some of us need self-soothing with different things, and a lot of us self-soothe with food or alcohol or sex. Why not say it? Just kidding, just kidding. That could be. It's healthy, especially if it's done staying at home. So anyways, let's start off with the questions that we've had today. And I'm going to have my team on my Zoom chat, like Gloria. I want to give out a shout out to Gloria. Gloria Miranda is our producer, and she does wonderful things all the way from Mexico where she's with 3 computers trying to do this whole magic trick. And she's got me here on camera talking or discussing either with our invited guests or with our patients. So anyways, let me start off with a question that comes directly from my staff, and then it leads off to other folks that have asked questions. I'm not going to use names because we didn't ask them if we could use their names, so I'll use initials. But OS says, we already know all the sort of precautionary measures to take during this pandemic. But as a leading weight loss surgeon, what extra precautionary measures can you still add to further protect your patients after surgery? All right. That's a great question. And I didn't prompt that question, but I'm glad it was done because I wanted to do a video for everybody that is looking into weight loss surgery, plastic surgery, or any other surgery during these difficult times. COVID-19 is a global epidemic, and it's hit every corner of the earth. Nobody gets saved from this unless you have resistance to it. Nobody's resistant to it because, well, humans have never been in contact. Thus, antibodies have never been formed. So what's going to happen? And that leads to my third question over there, fourth question that says, is everybody going to die? No, let's not go that tragic, but there are some stuff that we need to learn. What's typically happened in other pandemics, and some that were just epidemics and some that were small outbreaks, they all have a different definition by the size of their spread. is that they were limited by certain circumstances. This one is being limited by our condition of staying home, staying away from people, social distancing, and doing the things we were talking about, which is washing your hands and being very cognizant of all these vectors, droplets, etc., that can transmit the disease. This disease will either cycle itself in a second wave after this first wave slows down, maybe even a third wave, and then will come again next year. That's what's against us. That's what we're looking at. What do we know about the virus? It can be deadly. 20% end up in the hospital. Different societies, different nations are having different responses. Some have higher mortality, some have lower mortality. We'll talk about that in the questions and answers. So the shout out to Gloria was because I wanted her to send me the questions via Zoom right here on our chat. She can copy paste them and I can do this and read at the same time. So there are certain factors that promote the disease, which is basically living in society. The aggressiveness of the disease, 2 people will get infected for each one that's infected. Number 3, how stealth it is. In other words, you can be infected and you may never know. In fact, there's a study right now of Californians where they're testing for antibodies to see who had the infection last year. How's that? How's that for news? There's a probability that this infection was out there even before Wuhan had it. Maybe it spread to California. Maybe we all thought it was some other type of upper respiratory infection, influenza like the one I had. It hurts, man. I wanted to pull my teeth out. It hurt so much. My face hurt. And then there may be resistance already in society. We don't know. But that study sure is going to be really interesting. Going back to the things that are for the virus, it spreads easily. It's spreads in a stealth manner. In other words, up to 60% of the people that carry and spread the virus can be asymptomatic. So how do you know? All right, what's against it? Sooner or later, we're gonna create our own antibodies, obviously, if you have the infection. Or number 2, we can create the antibodies artificially, like a lab in California where they inject them and you have passive immunization. That means that you didn't create your own antibodies, they injected it in there. And they're gonna circulate in your body for a while, maybe 6 months, and then they're gonna die off. They're gonna be eliminated, then you'll be subject to an infection if those antibodies are not there. And active immunization is basically a vaccine. So that's where you get injected with a virus, or it can actually be oral. Israel yesterday, on Thursday of all weeks, on Passover Thursday, announced that they have a vaccine that may be in full development by June or in testing. I'd have to check again. But anyways, it seems to be oral. So those are the things that are against the virus and everything we're doing. So going back to the question, man, I love to talk, is as a surgeon, the first thing we noted, and we did this, we saw this early March, is that our patients were coming from all parts of the United States for weight loss surgery. Some of them you already know, or are you. And as soon as we heard about the outbreak, I did 2 things. I heightened our response at the hospital, our weight loss surgery hospital, which receives tens or dozens of patients a day having surgery, elective surgery. And the second thing we did is we heightened our strict measures to prevent infection with patients. And one of the things we did was obviously from the moment they got into the airport, we disinfected their luggage as it was being brought in, washed their hands, and then we gave them a mask to wear. Why the mask? Out of respect for other patients. So you say 5 to 10 patients are inside the van. They don't know each other. They don't know where they're coming from, but they know they're coming from all parts of the US, Canada, and the rest of the world. Well, cross-contamination is very easy in a closed environment. It was taken really nicely by everyone. And what happened is that everybody was wearing a mask. They would arrive to the hospital and it was all good and well. And everybody went into their rooms. They were still wearing a mask. They went to surgery. They went out and it was perfect. Why did I do that? Because what I just said, but apart from that, the transmission method of micro droplets. I'm going to leave it there because there's a question specifically about the World Health Organization, micro droplets, etc. And I'm going to address that one because it's extremely important. What have we learned so far? Now, I also happen to have the International Bariatric Club Oxford University webinar, which happens twice a month, and you will be getting links to those as well. They are medical in nature, scientific in nature, and we have the top global experts on certain topics. This past webinar, we were talking about COVID-19 and surgery, elective surgery. There's a paper recently published out there, scientific paper, that says that there's a 10 risk fold of having severe disease and dying in the post-surgical period. Okay? So for those of you considering traveling during these difficult COVID outbreak times, be careful. This is not the time you want to be traveling because there is a much higher risk during your convalescent period, during your recovery period, after elective surgery. It seems that this paper is, and some other testimonials, some collaborations done during that event that suggest that the disease could be much more aggressive after surgery. So elective surgery. So if you even to that point, even most hospitals are now deferring not only elective surgery, they're deferring emergency surgery. Why? Because there's a risk to the patient and there's also a risk to the surgeon, to the care provider. And there's many risks from the moment you're hospitalized in an environment that is now full of COVID patients, and then you're undergoing a procedure where you yourself can get contaminated as a patient and or the physician. Now, there are certain things we cannot postpone to a later date, certain emergencies that have to be done, and that's where personal protective equipment is so important. And one of our webinars, it's online, is specifically on masks. I'm going to quote a little bit about masks, but then I'm going to go back to the questions that are coming in. There's MDM says, as a healthcare provider in Washington state, the studies have shown microdroplets transmission of COVID-19 need to be interpreted with caution. WHO International has a good analysis on this. CDC is not advising masks for healthy individuals unless they are caregivers. Please do not encourage masks for healthy people for routine, as this would point we need to preserve PPE for healthcare providers. All right, I understand this is a healthcare provider saying, if you listen to my past webinar, the reason I broke it down to healthcare environment and the two masks, surgical masks and the N95 masks that are to be used by healthcare professionals, and then I broke it down to make it yourself, do it yourself at home with materials, domestic materials you will find available all through your house to make your own mask. There's two things here that are important. The use of masks protect the healthcare professional, mask and goggles, please, from infections like COVID-19, as we are practicing in the healthcare environment. Having said that, the reason I am encouraging everybody to use face masks is the same reason surgeons use face masks during the operation in an operating room. It is not only to prevent contamination from the operating room, which the sterility level is very high, or disinfection, let's call it. It's very low in bacteria environments, let's call it. But also it's a barrier. So when I'm doing surgery and talking during the surgical procedure, I'm not spitting out these micro droplets or breathing these micro droplets into the patient's wound or into my instruments that are touching the inner abdomen or whatever surgery I'm doing. So you see, a mask works both ways. It works as you breathe in, but it also protects, it becomes a barrier as you breathe out. This is why even the Surgeon General now reconsidered what the World Health Organization was saying. In their right defense of not causing compulsive buying, the World Health Organization says, no, it's only for healthcare workers. All right, healthcare workers are using the right protective material, the N95 mask, the surgical mask, etc. What I'm encouraging is that everybody uses masks while they're in the environment, in their own city, going to the market, doing their activities as much as permitted by your local government. Why? Because as you diminish the droplet load in the environment, you not only diminish the probability that somebody else is going to breathe into that droplet, especially if that droplet came from someone who is asymptomatic but is spreading the disease. It also diminishes the viral load in those micro droplets that then will fall into the counter, into the vegetable aisle, into the teller desk, etc., etc. This is why everyone should be wearing a mask. Are these theories? Yes. Are these theories logical? Pretty much, because that's the reason why I use a mask in the operating room, to be a barrier to protect my mouth and the liquid in my mouth to fall into a wound. By the way, the mouth is one of the dirtiest parts of anybody's physical body. So the mouth is highly contaminated with gram-negative, gram-positive, with anaerobic bacteria, with a lot of stuff. So careful when you kiss. All right, select who you kiss. All right, let's go back to the questions and answers. You guys give the questions, I give the answers. There is 2 questions related to newspapers. And they're talking, can I read my newspaper and be free from worry that it might be contaminated from COVID-19? If you're in a waiting room in a hospital where somebody else is infected or probably spreading the virus and they've already used the newspaper, I would refrain from touching that and anything else. If not, newspapers happen to be extremely clean because of the way they're processed through a machine, and then they're being spit out by the machine itself and then bagged. Especially if they're bagged, they tend to be extremely clean. And if not, they're handled by the cords that they're these big, packs when they're distributed. Ultimately, these are the rules. Cardboard, the virus, we can expect it to live around 24 hours. This is an average. It depends a lot of the external temperature, the humidity, et cetera, the dose of the virus. It's very different if a single virus lands on it than 10,000 viruses because somebody sneezed on it, or 10 million. Plastic, on the other hand, can last up to 72 hours. And metal, it's been said between 48 up to 21 days. There's different studies out there. Now, what are we to worry about? I'm going to show you a couple of videos that are probably more important because these are the things that we don't see. We see a lot of things that are pretty logical for us. And then some other things that we have to think about. Now, most of us are in quarantine right now. And when you're in quarantine, nobody goes out, supposedly, and nobody comes in. In fact, in San Diego, the order was given this yesterday, or day before yesterday, that no more meetings, not even 2 people. It was 10 and above were prohibited. Now, nothing. County ordinance. So now you can't see anybody. Nobody comes in, nobody comes out. And if you think you're safe, you're going to have to think twice because a lot of things come into your house even if you're not going out. A lot of people are going out because they need the basic necessities, which is toilet paper, it would seem. Number two, they need wine, and some are actually buying groceries. But if you're not going out, you still have to protect yourself. And I'm going to show you a quick video of what I have done. So let's do this. And I'm going to show you this video again from the start. You can see right there, I've got a little blue line right there, and that blue line means outside and the rest means inside. I've got a sprayer atomizer right there that has bleach diluted in water, 3/4 cup bleach diluted in a gallon of water, and that's how I disinfect stuff. It's a perfect disinfectant made at home. I also have a hand sanitizer. I have Lysol just for these teaching purposes, and I have a set of gloves. I have a line that limits who can pass. It's extremely important to know that. And then I also have an area where the packages are to be left. Now, why am I so careful with packages? Packages have cardboard. This cardboard is being carried by a carrier of mail, but he can also be a carrier of COVID-19. If this person is a carrier of COVID-19, you all know that when they carry their boxes, they're carrying them right on top and they're breathing on them and they may be talking. So everything on the top especially is exposed to those micro droplets. And this is why we ask our mail to be left outside that blue line. Everything that is, and I can't go back right there. Everything that surrounds the outside of the package is left outside. Once you leave a cardboard, plastic, or metal outside, the temperature changes will let it die during the next number of hours. Like we said, there are certain hours for each different material, surface material. Last but not least, you can see I've got a knife right there, and that knife stays outside the blue line. So that's your kit, your decontamination kit. So we've got that covered. What about groceries? Here's another thing. Your groceries are handled by the grocery clerks. They're handled by the grocery distributors. And then you're also handling the bags. The bags are put right in the grocery lane where everybody breathes, where everybody sneezes. And then they are put into these bags and they're transported home. One of the things you're seeing right here is that we're using special plastic boxes. Once it's been removed from the outer shell, now the inner shells are cleaned in your station back inside your home. What do we often do? We often bring in stuff from the outside without having this filter or this step where you decontaminate the outer shell, you remove the bags outside, you bring them in a separate container, which is to be washed because it's in contact with the inner shell. And then you actually put the food inside the sink where you're going to wash them. Soap and water is enough to wash most of the vegetables, most of the fruit, most of the produce, and the bags and the things that are bagged in the boxes, etc. And then you let them dry. And once you do that, then you can now place them in your cupboard, in your pantry, etc. And then you go ahead and wash the plastic. You wash the plastic bins. You remove your gloves. You wash the sink. And then the cycle goes on again and again. Is this doing too much? Well, reading that original post, what extra precautionary measures can you still add to further protect people? This. Remember, nothing goes in and nothing comes out. That's the best way to protect yourself during these difficult times. Uh, One of the other things that I want to talk about is we're going to switch channels a little bit because one of the biggest problems right now is we're seeing so much news, we don't know who to believe. And of course, news sells with big headlines. So most of the big headlines are negative headlines. And of course, that's enough to give anybody depression and go directly into preferring not shaving if you're a guy, wearing pants, uh, not wearing makeup, not combing yourself. I did today. Not changing because there's no routine anymore. There's no structure to our life, especially if you're stuck at home. Uh, Overeating, overindulging in food and alcohol, and getting depressed. So, this is why we're doing this. This is the reason why Stay Home but Stay Healthy is talking to the best experts. And one of the other experts was Ben Boquiquio. Ben Boquiquio is this guy that he's not only uh, 70 plus year old physician, this guy's been into sports and especially exercise and fitness for all his life. And he designed a program that is spectacular because it's 15 minutes twice a week. And this program will kick your butt. I tried it, it's challenging, even for those that are like meatheads and they lift weights, because I used to do my fair share of lifting weights. This is hard, this is difficult, and it's only 15 minutes. Anyone can do it. It's 15 minutes whole body workouts. The the basic premise of this whole program is slow up, slow down. It's all about resistance, and you don't even have to use weights. So you can watch that interview. We've got it on our social media series. Now, one of the people that I want to interview is Dr. Jason Fung. He's good friends with a lot of my good buddies from the people that brought you Low Carb USA, Doug Reynolds, Brian Lenskis, MD, that we're going to interview in the following weeks as well, and Dr. Ben himself. They're all collaborators in this new way of thinking about metabolic disease. Metabolic disease, a lot of you know what metabolic disease is, a lot of you don't care. You should care because only 12% of the US population is metabolically fit if you're an adult. And children are also metabolically impaired. All right, 1 out of 10 people are metabolically fit. This means that either you have excess weight, obesity, diabetes, high blood pressure, high blood sugar, high insulin, sleep apnea, high cholesterol, high triglycerides, PCOS, polycystic ovarian syndrome, infertility. That's metabolic disease. 9 out of 10 of us have it. It's not something that you can have and can't have, as in, I'm pregnant, I'm not pregnant. It's progressive, but it all starts with the tattletale signs. Sooner or later, as you age, it will deprive you of health and of your life. That's metabolic disease. That's why we're inviting over all these experts that are this trend we're talking about, which is metabolic disease is not curable with medication. Anyone who's been hypertensive will always be hypertensive unless they did something completely radically different. Hypertension medicine will not cure the hypertension. Anyone who has cardiac disease will not get cured from cardiac. Anyone who has insulin problems and diabetes will never get cured with a medication. So we're really palliating. We're managing disease. We're not health preservers or health care, caring for health. But it so happens that this group, this movement of investigators, scientists, physicians, even journalists have created this global movement of metabolic wellness. This metabolic wellness doesn't have to do with medication. It has to do with what you eat. Simple as that. What you eat, and of course, exercise has to do how much you sleep, how you de-stress, how you move, physical activity and exercise, two different things, as Dr. Ben was explaining. And all these things are the stuff that we want to break down for you on each episode, because I want you to be metabolically fit, metabolically healthy. And in order to do that, one of the things we want to talk about is with Jason Fung, who's the guy that really started off, and he's pretty famous now online, with intermittent fasting. And that's where the question comes in. Let's go to the question. Does intermittent fasting work? I have seen many people that are doing this now. All right. I have to give a little bit of perspective and understanding so we can, a little bit of background so we can understand what exactly we're talking about when we say keynote. Sorry, guys. I'm looking for my keynote presentation because I'm going to share that with you guys as well. When we're talking about intermittent fasting, first we have to understand why we don't believe that eating all day long is good for you. Eat 6 meals a day, small meals. The only reason you would eat 6 meals a day is because you're hungry all day long. But there's other ways to actually nourish your body without having to eat all day long. In this day and age, our food sources are incredibly varied and they're incredibly cheap. Unless you're eating ribeye, unless you're eating animal products, unless you're eating eggs, milk, cheese, what is incredibly cheap? Carbs are incredibly cheap. Sugars are incredibly cheap. Starches are incredibly cheap. Grains are incredibly cheap. And the US population, on average, eats more than 50% carbs in a day. This is a big, big talk, but I want to break it down to you in very simple terms. What I'm going to do is just tell you what intermittent fasting does. And intermittent fasting is basically giving your pancreas a break. Every time you eat food, you're either going to eat a protein, fat, or a carb. Having said that, the standard American diet calls for everybody to eat carbs. What happens every time you eat a carb stimulates your insulin secretion like this. Insulin is basically the hormone that makes you fat, right? Insulin stores fat. It locks it in there. Won't let it go, right? Okay. You're not going to like insulin. What else does it do? It responds to sugar. When sugar comes in, insulin responds. And you eat your sugar because you need your energy, right? You know how much sugar you need to have normal blood sugar? A couple of teaspoonfuls in your blood. We eat way more than that. So your meal is sugar, then a little bit of fat, because fat kills, everybody says that, and then protein. Protein stimulates a little bit of insulin response. Fat does not at all. So every time you have a meal, what you're going to do, and I'll use a whiteboard. If you eat a meal right there, can you barely see that? Can't see it. No worries. When you eat a meal, your blood sugar goes sky high, and then your insulin responds and it goes sky high. It metabolizes that blood sugar, and then it's stuck into your liver especially, and then you go into low blood sugar. Your insulin responds, and it does what it's supposed to do. It grabs that sugar, opens the cell, and then the sugar can come into the cell. Well, once you have low blood sugar, you get hungry again. So what do you have to do? You have to eat again, and again, and again, and again. So if you picture your body as a receptacle, as you're pouring sugar into it, we're over pouring sugar into it. The more sugar you pour into it, the more sugary your blood is going to be, the more insulin you're going to need to push it into the cell. But there comes a moment where your insulin is not enough and you have to produce more, and then more, and then more. The more insulin you produce, it does two things. The more effective it is at pushing that sugar into your cell. But the more it creates insulin resistance. As you produce more insulin, you become more insulin resistant, which means that you have to produce more insulin because your body now does not respond to the levels of insulin you're producing right now. Let's go back to this whole premise of not eating, intermittent fasting. If you don't eat sugars and you eat protein and fat, you're going to have a smaller insulin response. Thus, you're going to metabolize the macronutrient, but you're not going to become insulin resistant. Now, what happens if you don't eat at all? Your pancreas is taking a break. There's no insulin. There's no production of insulin in the blood. You may be hungry. There's tricks for that, but you're at least giving chance of your fat to release into the metabolism versus staying locked in with the insulin. The modern way of eating has provided us since the early 60s with the idea that we should be eating a certain way. And this I can show you. Bear with me. I want to show you the, well, let's cut into our slides. Beautiful. Okay. Right there. Okay. Remember I told you the 60s? This is 1961 when the American Heart Association sponsored and adopted the idea of using a food pyramid. You can see up on the top, it says fats, right? And fats, oils, and sweets, they call it, right? They're differentiating sweets from carbs here, which I don't know why they're doing it, but okay. And fats and oils. Folks, you ever heard of essential fats? Those are the ones that the body doesn't create. You have to consume them, and they're basically essential for life. Well, in 1961, this guy said, don't eat a lot of those, even though they're essential. Then you have to have small amounts of yogurt, cheese, meat, and poultry up there. But as you go down, you can have some vegetables and fruit, a lot of fruit, of course. And then look at the lower group. The lower group made basically from cereals, and which are grains, and rice, which are, again, sugars. We're going to talk about why this pyramid happened. This pyramid happened several years before because this guy created the heart diet theory. And he hypothesized that with this heart diet theory, in this theory, that if you ate fat, you were going to have heart disease. Now, let me change this. No está en inglés, no me la puso en inglés, nada. Presentations. All right. What this guy did, his name is Ansel Keys, is he created a study that was looking at the macronutrients that people ate. And what they were looking for was how much fat you ate. Forget about the sugar. So he studied all these people, and what he found was that people who ate a lot of fat, like here, would get more heart disease. So the conclusion was with these 6 countries that the more fat you eat, the more heart disease you're going to have. But the problem is that during those same years, 4 years later, a much larger study was done with 22 countries, and he had all the information on those countries, but he decided to remove them from his study. And what he did, he only published 6 countries while there were 22 countries, and the theory just does not agree with what he said. In fact, they used his theory versus all the information, scientific information out there 60 years ago. What did it end up doing? It ended up doing that males and females were now eating much more sugars during the next 30 years till the year 2000 and much less fat during the following years. The important thing to see is that even though this guy made this study, it's never been proven again that saturated fat or fat in general actually has anything to do with heart attacks. In fact, over 30 years of studies have proven, you see that? That's a line that says there is no effect of eating fat and heart disease. The only thing fat and heart disease is associated in is low fat diets versus low carb diets. What do low fat diets do? They're going to diminish your cholesterol, right? Cholesterol is still an enigma, and we're going to have several authors talk about cholesterol during the next number of weeks. And it's going to lower your bad cholesterol, the so-called bad cholesterol. All right? So that's enough reason not to eat fat. But on the other hand, if you look at a low-carb diet, what's going to happen? You're going to lose weight. Your BMI is going to be better. You're going to increase your good cholesterol, the one protects you and your heart. Your triglycerides are going to lower. They're going to get better, extremely lower. Those are also associated. These are called biomarkers, which means that these guys are going to get much better. And your blood pressure is going to get much better. These are much better markers for health than these 2 guys are. In fact, we still poorly understand cholesterol, but we greatly understand what triglycerides, what systolic blood pressure, and something that wasn't considered here is blood sugar. All these things are much better when you're on a low carb diet than a low fat diet. But this is probably the most important study we've seen in recent years. This is called this study is called the PURE study. It was done in 5 continents in 18 countries on patients population between 35 and 70 years. And what they did is they looked at the macronutrients, what basically people ate: carbs, protein, fat. And they followed them through 7 years, a little bit over 7 years, over 135,000 people. So what happens is that once they did the study, then they make these graphics, and pay attention to what I'm going to show you here. This is mortality right here, and this is major cardiovascular disease. Those are the 2 things that kill you. Death kills, and of course, cardiovascular disease kills. So when you looked at patients that eat carbs, or people that eat carbs, they found out, this is the midline, they found out that the more carbs you eat, the higher the probability you're going to die. Now, what about heart attacks? They also found that the more carbs you eat, there's a linear progression right there that you're going to have a major cardiovascular disease. Now, what about fat? It's interesting. The more fat you eat, the less probable that you're going to die during this period that was studied. And the less fat you eat, the less cardiovascular disease you're going to have. Now, with proteins, it was also protective. And here was a slight move, not too important with major cardiovascular disease. But what this study says, without a doubt, is that cardiovascular disease and death are associated to carbs, not to fat. And we're always being scared of fat. This is why even the media doesn't understand where to put their bets on. Originally, they were saying that this guy, Ansel Keys, was completely right. Then they said that the problem was cholesterol. And now it so happens that cholesterol is completely misunderstood, and now everybody can eat butter. So let's go back to the questions. We have time for one more question. And we're going to talk, when you talk about fat and oils, are you talking about saturated fats like in red meats, cheese, butter, etc.? This is a great question. Since we're finishing up with fats, only natural fats are good for you. And then a lot of you are going to say, well, vegetables are natural, so vegetable oil is good for you. No, it's not. Only natural oils and fats are good for you. There's certain oils that are available and appear in nature readily, easily, and some other ones that don't. So let's start off with the saturated fats. Animal fats are great for you. Why? Well, because you have fat, animals have fat, and the study I just demonstrated really doesn't have an association to eating saturated fats. Saturated fats have, in general, fats are essential to life. You can't live without fats. That's why they're called essential. By the way, proteins as well, and there's certain animal proteins that are essential, that have the amino acids essential. And I always ask my patients, have you ever heard of essential oils? Oh, yes. Those are the ones that the body doesn't produce that you have to eat them. Have you heard of essential amino acids? Oh, yes. All right. Okay. Have you ever heard of essential carbs? No, they don't exist. You can live without a carb all your life and nothing's going to happen to you. They don't have nutritional value. They just have energy value. But fat has 3 times the energy value than carbs do. When you're talking about fats, animal fats are great for you. Now, the sicker the animal, the higher the probability that that fat is going to contain something that is negative to your body, like a contaminant, like a pesticide, herbicide, fungicide, chemical fertilizer, plastics. They all are stored in the fat. And in this case, when you eat the animal, then you store it in your fat. The other thing is that you want to look at an animal that is not fed. Everybody's into grass-fed. Well, grass-fed means nothing. In fact, the FDA pulled the term because they're going to spray the grass, pesticides, herbicides, all this stuff, cut it, throw it into the lot, feed lot, where 1,000 cows are in a closet, and then they're going to eat the sprayed food. That's grass-fed means nothing. You want a self-feeding animal, roaming, free range. Preferably, you want an organic animal. What does that mean? That means they're out eating what they normally eat that's not been touched by man. When man touches food, they screw it up. Have you ever heard of mammals sick in nature? It's very rare. Mammals don't get diabetes. They don't get hypertension. They don't die of heart attacks. They don't get cardiovascular disease. Why? Because they're not fed by us. They feed naturally. And we were talking about this with Dr. Sywis. Well, do you know about sick cows? Well, of course, because they're in feedlots. They're being fed stuff like corn, which is high in sugar, high in carbs, and they're getting the same diseases us humans are getting, and we're supposed to be the smart ones, right? And then those cows, immediately before they die, drop dead of disease like diabetes and high blood pressure and etc. Can you imagine fattening a cow in 3 months, double its size with sugar? Of course they're going to be sick. And all the mediators that cause the inflammation, because sugar is a disease of inflammation, insulin is a disease that causes high blood sugars, and then the inflammation comes in through your mouth. So all these cows are extremely diseased, and now you're eating the same mediators that are causing the heart attack on the cow. So why do we get sick? We don't know, because we want cheap food. Why is it cheap food? Because the grains are subsidized by the governments, corn, soy, and then with the surplus of grains they have, they sell at pennies on the dollar to the livestock, and then they're raisers, and then those guys feed it to their animals, and that's why we get cheap meat. So if you're gonna eat animal meat, eat organic animal meat. I'm almost running out of time. I just want to say animal meat, so your protein, your fat, fatty meats are great for you. And I'll give guys especially an example. The other thing is that other fats that are good for you are olive oil. Can you press an olive and see the oil coming out? Of course you can. That's called cold pressed. And that's what you want to do. Anything that can be cold pressed into an oil is good for you. That's why cold pressed olive oil is good for you. Cold pressed avocado oil is good for you. Cold pressed coconut oil is good for you because they're not treated with heat. And butter, clarified butter, by the way, coconut oil, avocado oil, and clarified butter, they're all good for higher temperature cooking. Highest temperature, stay away from that as well because it denaturalizes certain protein, causes some chemicals to burn, and then that could be associated to other stuff we'll talk later. And those are the ones you want to eat. What do you want? And of course, the other oils that come from almonds, nuts, etc. Be careful from peanuts; they're not really nuts themselves. And keep away from the vegetable oils and other oils that have been chemically processed. Doesn't say there, but vegetables, if you squish a cabbage, you're not going to find oil. If you squish a zucchini, you're not going to find oil. You can't cold press it. So what is done is these vegetables, oil, corn oil, they're squeezed into a gray slush, and then they're chemically and electrically processed until they're clarified. Why? Because there's an overproduction of corn, and they got to find something to do with it. So now they're feeding you oil, which is bad for you, and probably, extremely probably, very new studies are talking about heart disease, associating heart disease in all these vegetable oils. And if you ask yourself this question, what is most food cooked in, either in food industry or restaurant industry? Vegetable oils. 50% of the United States adults have heart disease. Can there be a correlation there? So what oils to eat? We just said it. Eat animal fats, and the oils are ghee, olive oil, avocado oil, coconut oil, and that's about it. Those are the things you want to take care of. I think we've answered a lot of questions today. We're going to be back next week with an interview with Dr. Doug Wong. This guy is not only a bariatric surgeon who's trending 14 million on his last video on YouTube. This guy is a progressive thinker, and he's a guy that has created a program for his patients to follow. Spectacular talk with him. We're editing and we're going to upload it. He's got it up on his channel right now. And next week, we're also going to talk to Commander Bobby Brown, U.S. Navy retired. He's going to talk to us about structure, putting structure into your day, into these days where we're staying at home. And he's going to make a nice comparison to the moments when he used to be deployed and during his Navy years. And I think it's going to be something very positive for you and for your family. All right, guys. Well, we're out of time today. Thanks for all your questions online. And please, if you have any question, go ahead and just put them on your social media feeds. We'll grab them and we'll place them during the next questions and answer sessions. Promise to next time have a lot more material. This is a one-man show right now. Shout out to Gloria and to all my team, Anna, Pam, doing all the designs down there. And please post your topics you would like to talk about. I definitely want to talk about topics that are trending right now. Even if somebody's willing out there to be interviewed and go back and forth, I'd love to do that as well. This is all the time we have for today. This Stay Home and Stay Healthy webinar series. Catch you Tuesdays and Thursdays for the webinars and Fridays for questions and answers. Thanks for watching. Stay safe, stay at home, and God bless.